So my name is Huynh. I'm from Saigon VietAI teaching team. So I'm very honored to be here and talk about my project, lung disease diagnosis with chest ray bone shadow exclusion. I have done this project with my friend Chuong and I would be advised by Professor Minh Chuong when I was a student at University of Science. So firstly, I want to show a short demo video. Okay, you can see like with an input as a chest ray image. So our model can provide some useful extra information to the doctor to give the better diagnosis result. But the question here is that why we need to build that model and why we choose the lung disease. So following the survey from WHO in 2015, lung cancers share the largest proportion in cancer mortality, actually in USA. And moreover, for pneumonia is a thorax disease. It's a leading cause of death in children, actually under the 5 years old. In normal thorax disease diagnosis process, firstly, the doctors will take a look on the medical history of the patients and also observe on the breath when they are doing physical exercise. If the patients have any symptoms, they will be asked for further examination. And chest ray will be the most economical and effective one. So in the chest ray examination, radiologists will take a look on the lung shape as well as the injury region in the X-ray image. The more accuracy of these stars, the more experience is required. So with the development of AI nowadays, computers can have the doctor on giving useful information and have them to give the accuracy diagnosis result. So our project have provide the method to improve the accuracy of chest lung disease diagnosis on chest ray image. In normal chest ray image, so the injury region would be often hidden by the bone shadow. So you can see in the picture below. So we apply some technique to remove or exclude the bone shadow from the X-ray image. But it raises to another questions, like what if the key feature, actually the injury region in the X-ray image would be removed? So we evaluating on both origin and the bone cell exclusion X-ray image to diagnose the disease. Our experiments have done on the chest ray 14 dataset containing more than 100,000 X-ray images from the USA. And the final result have compared with the result from the ChestNet model at Stanford University. Traditionally, if the doctor wants to build a soft tissue image, actually the bone cell exclusion image, they need to use they need to capture two different X-ray images with two different X-ray level. So this method is very harmful for the patients. So we tend to build a model the deep learning model that can extract, that can remove the bone shadow with only one shot. And these models have used in the modern X-ray device. So with the input at the X-ray as a normal X-ray image, we construct the sharp tissue with the deep learning model and enhance the contrast after that. Then we used both the normal X-ray image and the bone cell exclusion one to diagnose the disease, actually 14 disease in lung. So we have two dense net, and the output is the probability of disease and also the heat map that the doctor can use. So this is a detail of our model containing two dense net, and the last layer would be concatenated to a fully connected layer and giving the robability. And our final results show that we have better outcrop value on 8 of 14 disease, and our average outcrop is also higher than the ChaseNet model as published in 2017 from Stanford. So we have also published a paper as KSC 2018 last November, and has been accepted as long paper. Yeah, thanks for your attention.